Welcome to phase 2 of my knee pain relief exercise series. I'm Dr. Youssefzadeh, a specialist in physical therapy, and I'm here to guide you through the next step in strengthening your knees and lower limbs. If you've completed phase 1, you've already built a solid foundation, and now it's time to take it to the next level. Each phase in this series increases in difficulty to ensure steady progress, and phase 2 will challenge you a bit more to further improve your mobility and resilience. In addition to strengthening the muscles, I aim to incorporate functional exercises as much as possible so that these movements become even more useful in your daily life. The time you need to practice each phase varies from person to person. If you find a program too easy, feel free to move on to the next one. However, if a program matches your current condition, I recommend performing it for at least 1 week. If after that you still feel it's too easy, then it's time to progress to the next level. Stay committed, keep pushing forward, and let's take the next step together toward pain-free movement. In this phase, we focus on the hamstring while standing. Hold on to a support such as a chair, keep your body upright, and bend one knee to at least 90 degrees. Your working knee should not move forward and should remain aligned with the other knee. Aim for 3 sets of 10 reps. If you find this exercise too easy at the beginning or after a while, you can add ankle weights to make it more challenging. When using weight cuffs, start with lower weights such as 0.5 to 1 kilogram and gradually increase them. It's important not to rush into adding weights. The difficulty of the exercise should always be such that you can perform it comfortably without too much strain. Aim for 3 sets of 10 reps for each side. In the previous video, we focused on calf strengthening through bilateral standing heel rise. In this phase, we increase the difficulty with single leg heel rise. This is a progression, so only attempt it if bilateral heel rise feel too easy and you're ready for a challenge. For support, you can use a chair, place your other foot against your leg, and gently raise your heel. Make sure to avoid any pelvic deviation by contracting your glutes. And perform the exercise vertically, keeping upright your body throughout the movement. If you can perform a single leg rise without too much strain, at least 6 to 8 times, go ahead and do it. If not, place your other toe on the ground and use it for minimal support to complete the exercise. Aim for 3 sets of 10 reps. If it's difficult for you, start with 2 sets of 6 to 8 reps and gradually increase the sets and reps as you get stronger. The hip adductors are the next muscle group to strengthen. In this phase, hold on to a support such as a chair and adduct your leg against an elastic band. Make sure the elastic band is neither under tension nor too loose. Its normal length should be fine. To begin, position your feet slightly wider than your shoulder width apart. Adduct your leg against the band and hold the position for 3 seconds. Then return to the starting point. Be sure to avoid any trunk bending. During the adduction, avoid putting your foot on the ground. 1, 2, 3. Engage your abdominal muscles throughout the movement. 1, 2, 3. At first, it's fine to rest your foot on the ground after turning back. But as you progress, you can perform the exercise without doing so, allowing for greater freedom of the movement, like this. 1, 2, 3. 1, 2, 3. 1, 2, 3. Adjust the resistance so that you can perform the movement with full control without needing to throw your leg, as this may cause muscle strain. This is very important. I must emphasize that the elastic band should not be so stiff. It should be light enough that you're using around 40% of your strength. Aim for 3 sets of 10 reps. To strengthen the dorsiflexors, which are crucial for stabilizing the knee joint, hold on to a support such as a chair and keep your body upright. Gently lift your toe off the ground and then lower it back down. Be sure not to move your pelvis backward like this and maintain an upright posture throughout. Rest for at least 3 seconds between reps, like this. 1, 2, 3. Second rep. 1, 2, 3. Third rep. 1, 2, 3. Fourth rep, and continue. Aim for 3 sets of 10 repetitions. If this is too difficult, start with fewer repetitions. To strengthen the gluteus medius while standing, hold on to a support such as a chair, keep your body upright, and gently abduct your hip. Make sure not to bend laterally. Abduct your hip only as far as you can without any trunk bending. It's a good idea to perform the standing exercises in front of a mirror so you can adjust your body position during the workout. Aim for 3 sets of 10 reps. To continue strengthening the hip external rotators, follow the same guidelines from the previous phase, phase 1. Start by lying on your side. Ensure your knees and ankles are aligned with your knees bent at a 90 degree and your hips flexed at about 45 degrees. Next, externally rotate your upper hip, making sure your ankles stay together and your trunk does not rotate backward. Focus on controlling the movement without compensating. If you feel ready to progress, you can add resistance by using an elastic band or weight cuffs around your thighs. Make sure your resistance is light enough that you're working at about 60% of your strength. This will help prevent compensatory movements and avoid muscle soreness. Please don't rush into the exercises. The goal is to gradually increase strength without sacrificing form. Aim for 3 sets of 10 reps. To continue strengthening the quadriceps, this exercise is a progressed version of the one explained in phase 1. Follow the same basic guidelines but with an increased challenge. Begin by sitting on the floor or on a table with your legs extended in front of you. Place a foam roller or any object with about a 13 centimeter diameter under your knee. If you experience back pain or want to protect your spine, consider leaning back against a wall. Next, gently press your knee down into the foam roller and try to lift your heel off the ground. Hold your heel up while your ankle is at 90 degrees of dorsiflexion. After 6 seconds, gently lower your heel back down and switch to the other side. If this exercise becomes too easy, you can add weight cuffs around your ankle to make it more challenging. Start with lighter weights, such as 0.5 to 1 kilogram, and gradually increase them. It's important not to rush into adding weights. To strengthen the hip flexors and improve the hip stabilization, perform the straight leg raise. Begin by lying on your back with your non-working knee bent and a foam roller placed under your working leg. Engage your abdominal muscles, dorsiflex your ankle, and gently raise your leg while keeping your knee fully extended to a 60-degree angle. Then lower your leg back down like this. It's recommended to perform the exercise over 6 seconds, 3 seconds for raising your leg and 3 seconds for lowering it. Repeat the exercise for 3 sets of 10 reps. Remember, if you have any history of surgery on your vertebral column or hips, or if you are suffering from a specific medical condition, it's important to consult your healthcare provider before attempting these exercises. Great job on completing phase 2 of the knee pain relief exercises series. You've made important progress in strengthening your knees and improving your mobility. Remember, consistency is key, and it's important to listen to your body. If any exercise feels too challenging, feel free to return to phase 1 and work on those exercises before moving forward. If some exercises feel too easy, it's time to increase the intensity. Also, make sure to rest between sets. To stay active during your rest periods and save time, consider using a circuit format. In a circuit format, you will perform a series of exercises, one after the other with minimal rest in between. After finishing one round of all the exercises, take a longer rest and then repeat the next set. This method helps making your workout both more efficient and time effective. Keep up the great work and don't hesitate to comment if you have any question or need further guidance. I look forward to seeing your progress as you continue toward pain-free movement. Thanks for watching, and I'll see you in the next phase.